We're not going to go back to discriminating against Americans with pre-existing conditions. We're not going to go back to a time when people's coverage was dropped when they got sick. We're not going to go back to a situation where we're reinstating lifetime limits in the fine print so that you think you have insurance and then you get really sick, or your kid gets really sick, and you hit the limit that the insurance company set, and next thing you know, they're not covering you anymore. And you got to figure out how you come up with another $100,000 or $200,000 to make sure that your child lives. We're not going to go back to that. I hear Republicans in Congress object, and they'll say, no, we'll keep those parts of Obamacare that are popular. We'll just repeal everything else. Well, it turns out that the sum of those parts that are popular in Obamacare is Obamacare. Americans worse off when it comes to health care. And as I said, part of this is just, healthcare is complicated. Think about this speech. It's been pretty long, and you're just thinking, wow, I just want to take a picture with the rest of it. It's hard to get people focused on the facts. And even reporters who cover this stuff, and they do a good job, they're trying to follow all the debate. But a lot of times, they just report premium increases. And everybody thinks, wow, my insurance rates are going up. It must be Obama's fault. Even though you don't get health insurance through Obamacare, you get it through your job. And even though your increases have gone up a lot slower, or suddenly you're paying a bigger copay. Thanks, Obama. Well, no, I had nothing to do with that. So part of it is this is complicated, the way it gets reported. There's a lot of hysteria around anything that happens. And what we need to do is just focus on this very specific problem. How do we make sure that more people are getting coverage, and folks right now who are not getting tax credits, aren't getting Medicaid, how do we help them? How do we reach them? And we can do it. Instead of repealing the law, I believe the next president and the next Congress should take what we've learned over the past 6 years and, in a serious way, analyze it, figure out what it is that needs to get done, and make the Affordable Care Act better and cover even more people. But understand, no president can do it alone. We will need Republicans in Congress and in state governments to act responsibly and put politics aside. Because I want to remind you, a lot of the Affordable Care Act is built on Republican ideas. In fact, Bernie Sanders is still mad at me because we didn't get single payer passed. Now, we couldn't get single payer passed, and I wanted to make sure that we helped as many people as possible, given the political constraints. And so we adopted a system that Republicans should like. It's based on a competitive market-based system in which people have a responsibility for themselves to buy insurance. And maybe now that I'm leaving office, maybe the Republicans can stop with the 60-something repeal votes they take and stop pretending that they have a serious alternative and stop pretending that all the terrible things they said would happen have actually happened when they have not, and just work with the next president to smooth out the case. Because it turns out no major social innovation in America has ever worked perfectly at the start.
That's right.
Social Security didn't. Its benefits were stingy at first. It left out a whole lot of Americans. The same was true for Medicare. The same was true for Medicaid. The same was true for the prescription drug law. But what happened was each year people of goodwill from both parties tried to make it better. And that's what we need to do right now. And I promise, if Republicans had good ideas to provide more coverage for folks like Amanda, I will be all for it. I don't care whose idea it is. I just want it to work. They can even change the name of the law to Reagan Care. Or they can call it Paul Ryan Care. I don't care. That brings me to my final point. That is, change does not typically come from the top down. It always comes from the bottom. The Affordable Care Act was passed because the American people mobilized, not just to get me elected, but to keep the pressure on me to actually do something about health, and put pressure on members of Congress to do something about it. And that's how change happens in America. It doesn't happen on its own. It doesn't happen from on high. It happens from the bottom up. And breaking gridlock will come only when the American people demand it. So that's why I'm here. Only you can break this stalemate by educating the public on the benefits of the Affordable Care Act, and then pressing your elected officials to do the right thing, and supporting elected officials who are doing the right thing. And this is one of the reasons why I'm so proud of what Miami-Dade College is doing. Because it's making sure that students and faculty and people throughout this community know about the law, know about how to sign up for healthcare, and then actually helps people sign up. And I'm incredibly proud of the leadership of Joe Payne and the entire team in encouraging people to sign up. Thanks to them, Miami-Dade has been hosting enrollment office hours and workshops even on nights and weekends. Right here on the Wilson campus and on all the Miami-Dade campuses, you can go for a free one-on-one session where a trained expert can walk you through the process and answer any questions you have and then help you sign up for healthcare right there and then. Joe says he doesn't have a conversation without making sure people know how to get coverage. The more young and healthy people like you who do the smart thing and sign up, then the better it's going to work for everybody. And the good news is in a few days you can do just that, because open enrollment, the time when you can start signing up, begins on November 1st, and you just need to go to healthcare.gov, which works really well. Campuses will be competing to come up with the most creative ways to reach people and get them signed up. And I'm pretty sure that Miami-Dade can set the standard for the rest of the country. So much has changed since I campaigned here in Miami 8 Octobers ago. But one thing has not. This is more than just about health. It's about the character of our country. It's about whether we look out for one another. It's about whether the wealthiest nation on earth is going to make sure that nobody left behind suffers. Nobody loses everything they've saved, everything they've worked for, because they're sick. You stood up for the idea that no American should have to go without the health care they need. And it's still true today. And we've proven together that people who love this country can change it. 20 million people out there will testify. I get letters every day just saying thank you because it's made a difference in their lives. And what was true then is true now. We still need it. Our work to expand opportunity to all and to make our union more perfect is never finished. But the more we work and organize and advocate and fight, the closer we get. So I hope you're going to be busy this November signing folks up. But more importantly, I hope for all the young people here, you never stop working for a better America. And even though I won't be president, I'll keep working right alongside you. Thank you, everybody.